Thanks, Jane, and good morning, everybody. I'm John Alker from the UK-GBC. So yes, as Jane says, I've been having a chat with her and Michelle over the last couple of months around this issue of health, well-being and productivity in buildings. And as you know, this was the central theme of the recent World Green Building Week, and I hope it was as successful in your countries as it was in UK and Europe, where there was a real appetite and enthusiasm for these themes. So this is really all about how we take that forward. I know there's a lot of interest here, and I would just reinforce, I think, what Jane was starting to say about wanting to do this very much in collaboration with the whole of the network. It's not about replacing things that might be going on in your country. It's about trying to provide a bit of coherence around all of those great things that might be happening. So just to recap, I'm sure you're pretty familiar with this stuff. This is a fantastic visual from the business case report that World GBC produced and that was launched in March 2013. Which really brought together evidence from all around the world on a range of different issues. And one of the chapters was specifically around how increasingly green design features are being linked to positive outcomes in terms of the health, well-being and productivity of people in buildings. And some really fascinating stuff, whether that's around biodiversity or outside views, daylighting, ventilation, individual temperature controls, and so on, and the impact that, the positive impact that those sorts of features can have. But, and there's a but, the report also highlighted a number of important barriers which showed that, as it says there, there's still a way to go before this kind of evidence that is emerging is really being used to inform investment decisions, and before these sorts of features, the sort of best practice is being mainstreamed into the industry. And as a slight aside, of course, it follows that if we can make that case in a more robust and compelling way, then that becomes incredibly important when talking to decision makers. Now, imagine being able to say with real confidence to employers that if you are in a green building, you will get more from your staff. They will be healthier, they will be more productive. How much more compelling even than potentially marginal savings on their energy bills. And I think the feeling is that if we can really build that case, then it could be something of a game changer in terms of making the business case for sustainable buildings. So the proposal that I want to share with you, which to a certain extent is still in its formative stages, but as I've been beginning to share this with people, there is a lot of appetite and enthusiasm for it. The proposal is to focus on a couple of those key barriers, and I've described those as goals, so I'm going to just share with you two of those. The first is an attempt to address the barrier around the lack of common metrics for measuring the impact of health, well-being and productivity in buildings. Because of course, how can we really begin to prove this stuff if we can't even agree how to measure it? Now this is complicated. I'm not pretending it's really simple. But the proposal would be that a World GBC report propose a common metric for measuring health, well-being and productivity. Of course, the crucial bit being that that could be translated into financial benefits, and that we then begin to pilot that through your networks, through Green Building Council members around the world. And I'll come on to say a little bit more about how we do that, but really important point, this is not about reinventing the wheel. This is about seeing what is already out there. I strongly suspect there's some really good stuff out there, and that this is about bringing that together, coordinating, and proposing a way forward based on things that already exist. Second goal, to provide guidance and best practice information on what those green design features are that can lead to not only reduced environmental impacts that we're very familiar with, but also those positive impacts around health, well-being, and productivity. And that would therefore provide something of a resource, whether it's for designers or developers or other professionals to go to really understand what best practice looked like, where there had been successful examples of real projects on the ground that had used these sort of features, so bringing together case studies and so on. Now, I think it would be helpful to produce, a report along these lines, but I think the sort of medium-term objective, as I have described it, is something which is more like an ongoing, live, regularly updated resource, a global library, for want of a better phrase, of information on healthy buildings and related issues with current and up-to-date information for people to use. Again, a very big fan of not reinventing wheels, and I don't know, but I suspect there may already be platforms out there that we could utilize, whether that's Pinpoint, which is a UK-GBC online platform that potentially could host and be adapted for this sort of a purpose, whether that is GBIG, that of course is the US GBC initiative, or whether it's something else. What is out there that could provide that sort of central resource for GBCs and for our members. And so the scoping of the answer to that particular question would also form part of this project that we're talking about. So last slide, just a few sort of nuts and bolts really. The initial proposal is that we do basically a one-year project that would start as soon as practically possible. We've got a bit of a business model out there, which is to get sponsorship from perhaps 3 to 5 sponsors, picking up to a certain extent where we left off with the business case report. UK-GBC is happy to take a lead on this. We're certainly getting a lot of demand from our members to be active in this space, which is why we're happy to put some time and effort into it, but emphasizing that this is very much global in scope. We would suggest that we need a bit of focus to start with, otherwise this is going to get very, very complicated very quickly. So we would anticipate beginning with a focus on office buildings, up for discussion. There would be a lot, I think, of desk-based research, because as I said, I strongly suspect there is a lot of good information out there already. So this is about bringing that together, making sense of it, and looking for common themes. And of course, we would need to put together a group of experts around this project that are very closely involved, whether that's from academia or industry or NGO. And I think an important feature is that we would absolutely want to be consulting very, very widely with the whole of the GBC network. What is going on in your country? What are you aware of? And when we get to that point of beginning to coalesce, hopefully, around some proposed common metrics, what do you think of these metrics? How will they go down, in projects that your members are actually involved with, and to really test that. through a sort of global consultation exercise. And as I said, key outputs being a report at the end of that 1-year period, and hopefully some projects on the ground that are beginning to pilot the metrics that we come up with. And then medium term, something longer lasting and regularly updated in the form of some sort of global online hub. That's the vision. Very, very much up for your feedback. I'm well aware there's lots of stuff in the pipeline all around the network, and really keen that we could sort of work together, move forward in partnership. Thank you.
Rob?
John, would you be open to GBCs looking for sponsors to feed in, even with you to manage? But I would think that there'd be people in Australia that would be really keen to collaborate straight up front on the work globally.
Absolutely.
Talk to her.
To Katie, yeah, definitely. And it's important that we do that in a coordinated, joined-up way, as we've been discussing over the last couple of days. But I think we've got a short list. It'd be great to lengthen that a little bit and to have diverse sponsors and partners and global in nature would be absolutely fantastic. Yeah, agreed. And we've got a short list of potential collaborators, and we need to lengthen that. And certainly the work of people like the World Health Organization and other institutions that have had a focus on this. Again, I strongly suspect that they have done some good work here. Let's tap into that.
Thank you, John. Let's give him a hand again. Thank you.